I'm Dr. David Green with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today the topic is epidural steroid injections for spinal stenosis. Do they work? Should I have them? Those types of questions. Well, first of all, let's talk about epidural steroid injections just a little bit. They were started back in the 1960s, so it's been over 50 years of consistent use of epidural injections. They are not done very differently than they were back in the 60s. There are 3 ways of doing them now, as opposed to really just one back then, but the concept remains the same. You inject the steroid medication into the epidural space around the spinal cord, and it places a bathing, large, anti-inflammatory medication, steroid, around an area that's causing pain from inflammation. And that may be a disc herniation, disc, nerve root, pushing on that, or spinal stenosis in this case. Spinal stenosis affects millions of Americans. And basically what's happening is you have a spinal canal that, let's say, normally is about this large, and due to arthritis and disc bulging and overgrowth of bone, like bone spurs and soft tissue, you start encroaching on the spinal canal, okay? And it pinches on nerve roots, and it can cause pain in the buttock area, the hip, going down one or both legs, and it may not bother a person every day. It might, but it may come on very harsh for a few weeks, may go away for a few months, come back big time. So having surgery for that, to take a canal that's like this and opening it back up again, helps and is successful, but 1, it's not risk-free, and 2, it's not absolutely necessary. It's a quality of life decision, called an elective decision, okay? So how can you prevent the need for it or prolong the potential need for it? Well, the answer is there's multiple types of treatment, but one that's really good are epidural steroid injections. And let me explain what happens, okay? You go in to see the pain doctor, let's say you're 65, 70 years of age, still young, okay? A lot of life, a lot of recreational activities, a lot of mobility that you want and should have, all right? With modern medicine today, people should be allowed to be very active well into their 70s and 80s. There's no reason. Okay? Now, epidural injections can be done as a one-time thing or every few months. And when the pain doctor, orthopedic doctor, looks at your MRI, they can tell typically where you're tight or where the nerve compression is occurring. Okay? And then what the pain doctor can then do is localize the injections to those specific levels, usually it's more than one level, of where the problem is occurring. And that is done as an outpatient procedure. You go home the same day. It can be repeated every couple of weeks, up to 3 times in a series. And that's just been deemed as the standard of care in the United States, with no hard and fast scientific evidence behind it. Meaning that we're not exactly sure why the 3 injections over a period of 3 to 6 weeks has come into place, but that's kind of where we are, okay? If you get some relief from the first injection, it makes sense to have the second injection, and if you get some relief there, it makes sense to go ahead and have a third. If you get 100% pain relief after the first or second injection, save the rest for later, okay? What are the results of epidural steroid injections for spinal stenosis? They're very good. You take all these studies that have been done over the years, and the average is over 75% good to excellent results. So 3 out of 4 patients who get epidural injections do really well. You ask them would they have it done again, they say absolutely yes. I can play golf again, I'm back on the tennis court, I'm taking walks with my significant other, whatever the case may be, playing with their pet or kids or grandkids. They're able to start doing those types of things again without surgery, okay? Now keep in mind, spinal stenosis is a fixed mechanical problem. It's not something that an epidural injection is going to poof, make go away. It doesn't fix the problem. That's not what an epidural injection is designed to do. It is a proverbial Band-Aid, okay? But it's a really good one, very good. And it has very low risk associated with it. You're talking about less than a 1% chance of any risk whatsoever. Maybe a slight transient increase in blood sugar, slight risk of infection, very slight risk of some bleeding or a nerve injury. It's usually transient, but it's a very low risk profile, okay? So if you were having back issues, pain into your buttock or legs, or potentially pain that comes into your hip area, it may be coming from a spinal stenosis problem. And one that should not raise, the big time alarm, like I got a big problem, but start thinking this could be from a spinal stenosis problem, but it's very treatable, okay? You're in a club with millions of friends, right? That you don't know probably, but they have the same problem. It comes from arthritis. Arthritis affects tens of millions of people in this country every year. Spinal stenosis is one of the leading problems that leads to signs and symptoms of pain. Arizona Pain Specialist does thousands of epidural injections every year. Great outcomes. Well over 90-95% of patients have success with these procedures and physical rehab. They have chiropractors at every location. It's an award-winning board-certified team. They take pretty much every insurance, Medicare, a lot of the Medicaid plans, personal injury, workers' compensation, Medicare replacements, and there's locations all around the valley, okay? So call today at 602-507-6550. The number's on the screen as well. It's a lot of information on preferredpaincenter.com about epidural steroid injections and about spinal stenosis. You can see in pictures what the problem entails, other treatments that are available besides epidural steroids. But I bring those up today because they can go right to the source of where the compression is happening and put soothing medication around it, give you pain relief for months. It might only be days, but averages show months of pain relief. I'm Dr. David Green, preferredpaincenter.com. Your pain stops here.